Art. Maybe not, this is not a great marker.
I have markers.
I bet you have markers, yes.
Let's start over.
No, we're not starting over. Did you just make it start over?
No.
Okay. That's all right, you guys will enjoy this one. I've been told that, we'll throw that one in the trash, that people know my videos by what my scrubs were. That's what I was wearing. Wearing Mickey Mouse Valentine's.
Yay.
Yeah, okay. All right, so we have your SA node, you got your AV node, right? The SA node sends messages to the AV node, and that gives you a P wave, right?
Yes.
Okay. And then the AV node, like in a relay race, takes the baton and sends the electricity through the rest of the heart. You get a contraction, and you get your QRS, okay? Then everything rests, and you get a T wave, and then it all starts over again. Okay, so that's how it's supposed to happen. This is supposed to be narrow, which it doesn't really look at it like it because I'm not an artist, but normally this is narrow, and there's a P wave that's upright. So then you know it's coming from the atria, okay? So if for some reason the SA node is no longer working, we've had an MI, we've had surgery, we've had some kind of issue with our heart. Okay, so now the SA node is not working. Usually one of these other cells, because it could be any cardiac cell that can fire the electricity and take over. So for example with AFib, you'd have a bunch of different cells that are all trying to be in charge, right? Mine, okay? So you get a bunch of different shaped P's. With a junctional, it's going to be somewhere kind of in between the SA and the AV node. So like the junction, it's kind of like where the atria meet. It could be anywhere in between, okay? And you're going to have either no P wave, or you're going to have an inverted P wave. Okay, so that's the key right there, is the P wave goes downward, or there isn't one. Okay, now what is your normal rate when your SA is in charge?
60 to 100.
60 to 100. What if the AV node is in charge, the SA node's not working at all? 40 to 60. So what do you think about the junctional?
20 to 20.
It's probably gonna be less than that, right? So we're gonna say less than 40. Okay, so usually you have a slow rate. Now, if you have no P wave or an inverted P wave and your rate is 40 to 60, then it's an accelerated junctional, which is probably more than you need for your test. But and then if you have no P wave or an inverted P wave and you have a rate here, then you have junctional tachycardia.
That the 60 to 100 would be junctional tachycardia? No.
Junctional tachycardia, this one is accelerated junctional. And then just junctional is really, really slow. Okay? So who cares? Why do we care about junctional?
Because it's a slow heart rate, so they're not getting enough perfusion going around the body. That's going to sustain life.
Right,
for
so
very long.
perfusion, right, yeah, so perfusion is the key here. What does your P wave or your atria, what does it contribute to your cardiac output?
Stroke volume?
It adds stroke volume,
Preload.
preload.
Ejection?
Give me more.
Ejection fraction?
No, I mean, no, that's like, no, that's something different. It adds volume, right? So if we think about the physiology of the heart, which is your bag, so your heart rests and it fills, right? Right before it contracts, which is like right in here, your atria go, wait, we have some more, and they squirt the rest of their
Atrial
blood, yes, into the ventricle. So they give an atrial kick, and it's 30% of your cardiac output. So if you pump 6 liters a minute, your atria is contributing 2 liters. That's a lot, right? So somebody that's missing their atrial kick, not only junctional people, who else is missing their atrial kick?
Is it B fluttering or A fluttering?
AFib, A-flutter, because their atria are just like jello, and so you're gonna lose that 2 liters. So AFib, A-flutter, junctional, all of your patients gonna have all the same cardiac output issues. So if it was 6 liters a minute, now the atria quit working, now we're looking at like 4. So you're gonna have problems with oxygenation, fatigue, blood pressure maybe, perfusion to your organs, you could go into renal failure. Okay, so that's junctional, and that's why we care, the atrial kick problem. Okay, questions?